Okay, let's unpack this. Welcome to a deep dive where we're tackling your MSRA revision notes head on.
Yeah, let's get into it.
Our mission today is singular. Take that dense stack of information on leptospirosis and transform it into high-yield, easy-to-recall knowledge specifically for your revision.
Right. Think of us as your guides, sort of navigating the material you've already compiled.
Exactly. And leptospirosis is a really good topic for this, I think.
It is. Based on your notes, it's a fascinating zoonotic disease. It can go from, mild and flu-like to extremely severe.
Which makes it a key differential, right, especially in certain settings.
Absolutely. Key in tropical medicine and even for some presentations in, say, the UK. Having your notes structured by section like this, it gives us a perfect roadmap to hit all the crucial points.
Perfect. And we're focusing strictly on what's in your source material here. So let's dive right into the first section. What's the fundamental definition of leptospirosis, the anchor point?
Okay. According to your notes, it's an infectious disease caused by Leptospira bacteria. Simple as that.
Yeah. Leptospira bacteria.
Oh. And the core transmission route highlighted is contact with water or soil that's contaminated by the urine of infected animals.
Urine. Right. Which animals mainly?
Primarily rats. Your notes really emphasize that. It's a classic zoonosis, transmits from animals to humans.
Okay, so animal urine, contaminated environment, gets to humans.
Mm-hmm.
Seems like a good starting point. And the bacteria itself has a distinctive shape, doesn't it? I think I saw that in the notes.
That's right, yeah. They're spirochetes,
Yeah.
often described as having a spiral or like a corkscrew shape.
Spirochete. Okay.
It's actually worth remembering for the name the spiro in leptospirosis can help you recall that shape.
Ah, good tip. And the lepto part?
Well, maybe think of the bacteria leaping, leaping from animals or
Yeah.
contaminated water to infect people. Could work.
Leaping spirochetes from rat pee. Got it.
Mm-hmm.
That definitely helps paint a picture. Okay, moving beyond just the definition, what are the specifics on the cause? How does this transmission actually happen? Which leptospira we're talking about?
Your notes specify Leptospira interrogans, and they highlight the serogroup L. icterohemorrhagiae as a key one.
Interrogans. It's a hemorrhagia, right?
Yeah, and yes, rats are the primary reservoir. They're continuously shedding these bacteria in their urine.
So how do humans actually get it?
Well, humans get infected when contaminated water or soil or urine or even animal tissues comes into contact with cuts in the skin or mucous membranes.
Like eyes, nose, mouth?
Exactly. Eyes, nose, mouth. And your notes point out that flood conditions significantly increase this risk.
Ah, flood conditions makes total sense. Spreads the contaminated water everywhere.
Precisely.
And these bacteria, they can survive outside the animal host for a decent amount of time.
They're pretty hardy in certain environments, yeah. They thrive in freshwater, damp soil, vegetation, and can survive for months, apparently, especially if it's moist and warm.
Months. Wow.
Yeah. And while rats are the main source, the notes do remind us that other animals like dogs, cattle, pigs, other wildlife, they can carry and shed the bacteria too.
Okay, so it's kind of lurking out there in the environment. Your notes also mention two distinct ways this disease can present itself. Can you elaborate on those a bit?
Right, yeah. The notes describe two main clinical syndromes. There's the anecteric form, that's the milder one.
Anecteric meaning no jaundice.
Exactly, no jaundice. Often feels just like a flu fever, aches, that sort of thing. And this form is usually self-limiting, it just gets better on its own.
Okay. And the other one?
Then there's the icteric form. That's the severe disease, commonly known as Weils disease.
Weils disease, that's the one you hear about.
That's the one. This is where you see the significant organ involvement, liver, kidneys, jaundice.
And the notes kind of hint at why Weils disease gets so bad, something about the immune system.
They do briefly mention that. An excessive immune response or maybe uncontrolled cytokine production might play a role in the severity and the organ damage you see in Weils.
Right. So the body's reaction makes it worse.
Potentially, yeah. For revision, a good way to lock down the basics of etiology and transmission might be that RATU connection from the notes.
RATU.
Yeah, rat, urine, transmission via water soil. Helps bundle it together.
RATUW. Okay, I like that. Simple. So, given how it spreads, who is particularly vulnerable, who's most at risk, what are the key risk factors we should be looking for?
Your notes list several clear risk groups. Occupational exposure is a big one.
Makes sense.
Both direct contact, like farmers, vets, abattoir workers, rodent control people, and indirect contact.
Indirect. Like how?
People like sewage workers, miners, military personnel, construction workers, plumbers, and especially flood relief workers. Your notes emphasize that.
Ah, right. Flood relief.
And the notes specifically highlight high risk in tropical regions and for rice field workers, too.
So basically, anyone whose job puts them in contact with potentially contaminated water or soil or animals,
Pretty much, yeah. And beyond occupations, recreational water activities are a significant risk.
like swimming in rivers or lakes.
Exactly. Swimming, kayaking, even just wading in fresh water.
Mm.
Geographic location matters a lot, much higher incidence in rural and tropical areas, and logically, areas with poor sanitation.
Because of the environmental contamination.
Right. Knowing these risk factors is absolutely critical for your MSRA revision because it helps you, trigger that suspicion for leptospirosis when you get a case scenario.
Yeah, definitely need those triggers. Is there a mnemonic for this?
The notes suggest one. Worst locations.
Worst.
Yeah. Water exposure activities, occupational, recreational, sanitation poor, tropical locations.
Worst locations. Okay, that's useful for remembering those high-risk groups and settings. Good. So now we know who gets it and how. Let's talk about what happens inside the body. The pathophysiology section in your notes was quite concise. How does this bug actually cause the damage?
The notes summarize it pretty clearly. Basically, the Leptospira bacteria get in through breaks in the skin or mucous membranes.
Okay, entry point.
Then they quickly spread throughout the body via the bloodstream. Systemic spread.
Right through the blood.
And from there, they directly damage the lining of blood vessels, the endothelium, and various organs. Your notes specifically emphasize damage to the liver and kidneys.
Which ties into Weils disease again.
Exactly. That's key to understanding Weils. And as we mentioned, the immune response might also contribute to the tissue injury. So the pathway is simple. Entries spread damage, endothelium, and organs, particularly liver and kidneys.
That makes sense. Spreading through the blood allows it to hit multiple systems. Now, because those early symptoms can be so, well, non-specific, what else should be on our radar? What other conditions could look like lepto? Your differential diagnosis list was quite long.
It was, wasn't it? And that really highlights the diagnostic challenge. The notes look a whole range, including influenza, dengue fever, malaria, typhoid fever, yellow fever.
Oh, the classic fevers, basically.
Yeah, the febrile illnesses. Then there's Legionnaire's disease, viral hepatitis, meningitis, and even toxic shock syndrome.
Wow. So quite a mix.
It is. And you can see why many start with that fever and muscle aches picture. But then you have conditions like viral hepatitis and Weils disease sharing jaundice and liver involvement.
The jaundice overlap.
And meningitis shows up both in the differential and as a potential complication of severe lepto. Toxic shock syndrome shares that severe systemic illness picture.
So how do you keep that straight for revision?
Grouping them might help, like group by overlapping symptoms, the febrile illnesses together, the ones causing jaundice, neurological stuff like meningitis, or the severe systemic shock pictures. That could structure the list in your mind.
That's a smart approach. Okay.
Yeah.
Speaking of how common it is, what about the epidemiology? Where are we likely to encounter this? Is it something we see often in the UK, for example?
Your notes draw a really clear contrast here. In the UK, leptospirosis is rare, typically seen in sporadic cases, mostly linked to travel to endemic areas.
So mainly imported cases.
Pretty much.
Yeah.
But globally, it's a completely different story, much, much more prevalent in tropical regions. And it's actually listed in your notes as the most common zoonotic infection worldwide.
Wait, the most common zoonosis globally?
Really?
That's what the notes say. It's a striking fact, isn't it?
Yeah, definitely one to remember for revision.
The incidence rates really reflect this variation. Something like 0.1 to 1 case per 100,000 people per year in temperate climates, but it can soar to 10 or more per 100,000 in tropical areas.
Huge difference.
Massive. And epidemics, often linked to flooding, like we said, can push rates over 100 per 100,000.
Incredible numbers.
So for revision, the take-home is you should absolutely be considering leptospirosis in patients presenting with a suggestive illness if they have a history of travel to the tropics or relevant exposures.
Got it. Travel history is key.
And specifically think Weils disease if they have severe hepatorenal failure, especially with those risk factors we talked about. Okay, so prevalence is highly location dependent, but globally significant. What about the actual signs, symptoms? What should we be spotting? What does someone with leptospirosis look like?
Well, the clinical features range quite a bit, from mild to severe. Commonly, patients will present with a high fever, severe headache, muscle pain, myalgia, chills. And often that characteristic sign highlighted in your notes. Red eyes.
Red eyes. Specifically
subconjunctival suffusion. Your notes emphasize this.
Subconjunctival suffusion. What does that actually look like? Is it different from just tired, red eyes.
The notes imply it's more of a uniform redness across the white of the eye, the sclera. Not just prominent blood vessels like you might see with simple irritation or tiredness. It's considered a key clinical clue for lepto.
Okay, uniform redness. Got it. What else?
Patients might also have abdominal pain. And the illness can sometimes have that two-phase course we mentioned.
Right, the biphasic pattern.
Yeah, an initial sort of flu-like phase, followed by a second more severe phase in Weils disease with the kidney injury, jaundice, and maybe aseptic meningitis.
Okay, 2 phases, check. What's the time frame? How long after exposure do symptoms usually start?
Incubation period is typically 7 to 12 days, but your notes give a wider range from 3 days up to maybe 30 days.
3 to 30 days. Okay.
And other features listed include things like nausea, vomiting, cough, maybe conjunctival inflammation, which is broader than just the suffusion, signs of bleeding, lung involvement, kidney dysfunction. It can be quite varied.
So if you see a patient, maybe someone who works outdoors or a traveler who's been swimming in rivers, comes in with fever, bad muscle aches, and those distinctly red eyes, that should set off alarm bells.
Absolutely. That combination, especially with a relevant exposure history water contact, tropical travel should scream, consider leptospirosis.
Is there a quick way to remember that initial cluster?
Thinking fever plus mucous plus red eyes is lepto could be a great initial filter. Then you layer on the signs of potential severity. Jaundice for liver, AKI for kidney, meningitis for brain, bleeding, particularly in the lungs or elsewhere.
Fever, matchies, red eyes, plus the severe signs. Good hook. Okay, so once we suspect it based on that clinical picture, how do we actually confirm the diagnosis? What are the key investigations mentioned in your notes?
Diagnosis usually relies on lab tests. Your notes mention serology detecting antibody.
Antibodies.
But it's important to remember these typically only become positive after the first week of illness, usually around day 7 or later.
So not great for early diagnosis then?
Not for early diagnosis, no. For that, your notes list PCR. That detects the bacteria's DNA.
PCR for DNA.
Exactly. So PCR is particularly useful in the early phase of the illness before those antibodies have had a chance to develop.
So the timing of the test is crucial depending on when the patient presents. PCR early, serology later.
Precisely. That's a key takeaway. Culture is another option mentioned, but it's apparently difficult and slow.
Right.
Your notes state cultures might be positive in blood or CSF during the first 10 days, and then in urine during the second week. So again, timing matters.
Are there any other common lab findings? Stuff that might point towards lepto or show how bad it is?
Yes. Your notes list quite a few non-specific findings that can support the diagnosis and show the systemic impact. Things like signs of inflammation, a raised ESR,
Okay.
changes in blood counts like thrombocytopenia, low platelets, which is quite common, leukocytosis or sometimes anemia. Liver enzymes can be elevated, showing liver damage.
LFT's up.
Yeah. Your notes also mention a prolonged prothrombin time, suggesting clotting issues. Kidney function tests will often show dysfunction or even frank AKI in severe cases.
UNEs, creatinine.
Exactly.
Yeah.
And creatine kinase can be elevated from muscle damage or rhabdomyolysis. Urine tests can be abnormal. A chest x-ray might show pulmonary involvement. And CSF studies might show pressure changes if meningitis is present.
So a whole battery of tests showing systemic impact.
Right. Thinking of these tests as showing the hit on inflammation, blood components, and those key organs, liver, kidney, muscle, lungs, helps tie them all together.
That gives a clearer picture of what those bloods are actually telling us in this context. Okay, so once we've hopefully made the diagnosis, how is leptospirosis managed, according to your notes?
Management is primarily supportive care plus antibiotics.
Supportive care first.
Absolutely crucial for all patients, focusing on hydration, pain relief, and managing any specific organ complications as they arise. Severe cases definitely need hospitalization.
Makes sense. What about the antibiotics? Your notes mention something about their effectiveness being debated.
They do mention that, yeah. A Cochrane review apparently found unclear effectiveness, but antibiotics are still widely used based on clinical experience and other guidelines. Seems to be standard practice.
Okay, so what are the choices?
The notes specify, for milder disease, especially if you can start them within 48 hours of symptoms starting, oral doxycycline or azithromycin are preferred.
Doxy or azithro early for mild cases.
Right. For severe disease needing hospitalization, the recommendation is intravenous penicillin G. Your notes specifically mention high-dose benzodipenicillin.
IV Pen G for severe cases.
Okay?
No.
So antibiotics depending on severity and timing, plus just keeping the patient stable and tackling any organ issues.
Anything else mentioned for management?
Intensive care is often needed for severe Weils disease. Your notes mention controversial steroid use in certain severe presentations, like maybe severe lung involvement, and vitamin K if that prolonged PT is causing bleeding issues.
Right, for the clotting.
Yeah, mechanical ventilation might be needed for pulmonary involvement.
Hmm.
And then long-term, they emphasize encouraging lifestyle changes to prevent re-exposure.
Because there's no widely available human vaccine.
Exactly. Prevention focuses on avoiding the source.
Okay, so what's the typical outcome? What's the prognosis like for someone who gets leptospirosis?
Well, the good news is most patients recover fully, particularly with early diagnosis and treatment.
That's reassuring.
However, your notes stress that severe cases, especially Weils disease, can lead to significant organ failure and, unfortunately, death.
So the prognosis is really variable.
Very variable. The mortality rate depends dramatically on the region and severity. Your notes, quote, figures up to 22% in developing countries, but maybe around 5% in the UK.
Still significant, though.
Definitely. Mortality is also higher in older patients. And one specific complication, severe pulmonary hemorrhage, has a very high fatality rate associated with it.
That sounds incredibly dangerous. What are the other major complications we need to be aware of besides that pulmonary hemorrhage?
The complications section in your notes lists several critical issues. Key among them are acute kidney injury, AKI, very common in severe cases, often needs dialysis.
Kidney failure.
Liver failure, leading to the jaundice we talked about,
Yeah.
and acute respiratory distress syndrome, ARDS.
Lungs, liver, kidneys, the big three for Weils.
Exactly. And as we mentioned, that severe pulmonary hemorrhagic syndrome is highlighted as a major cause of death.
Are there others listed?
Yes. The notes list others too, which really shows how systemic this can be. Thrombocytopenia leading to bleeding problems, rhabdomyolysis, that severe muscle breakdown. Various eye problems can occur. Hypotension, which can be fatal if not managed aggressively.
Wow, okay.
They also mention less common things like cardiovascular complications. Apparently, Kawasaki disease and erythema nodosum have been associated. And there's a risk of spontaneous abortion in pregnant women.
So a wide range of potential problems.
Definitely. Recognizing and managing these complications promptly is essential for improving the prognosis. Maybe that mnemonic helps here too. Leptoseverity,
Leptoseverity. Let's hear it.
lungs hemorrhage, ARDS, eyes, pregnancy abortion, thrombocytopenia, organs, kidney failure, liver failure, skin, EN, Kawasaki, everything else like hypotension, rhabdomyolysis, kind of covers the main areas.
Leptoseverity, that's a powerful reminder of how many systems this infection can hit.
Wow. Okay, we've really broken down your notes here, haven't we?
Okay.
Covered everything from the basic definition and how you get it.
So the symptoms, who's at risk, how to diagnose it, treatment, prognosis, and those critical complications. We've stuck strictly to the material you provided, aiming to make it as digestible and hopefully high yield as possible for your MSRA revision.
Yeah, hopefully seeing how all the pieces fit together, how the transmission leads to certain risk factors, how the pathophysiology explains the organ damage, how the timing of symptoms affects which tests to use. Hopefully that makes this topic feel a bit more manageable.
I think it does. And it leaves us with some really thought-provoking points from your notes, actually. You know, ponder that statistic, rare in the UK, yet the most common zoonosis globally.
Yeah, what does that tell us?
Right, about environmental factors, maybe climate change, global health inequalities, or even just the absolute importance of taking a good travel history in clinical practice.
Absolutely.
Or just thinking about how that seemingly simple flu-like presentation can actually be, you know, a ticking time bomb, escalating to the severe multi-organ failure of Weils disease.
It really underscores why this diagnosis, while maybe rare sometimes, is so important to keep in mind, especially when you have the right clinical context.
Exactly. And with that, we'll wrap up this deep dive into your leptospirosis revision notes. Thanks for bringing your sources to us today.
Yeah, thanks for joining us. Taking this kind of structured approach to your own revision material, breaking it down section by section, really helps lock in those facts and connections.
It really does. And remember, for more help with your MSRA revision journey, be sure to check out pastthemsra.com and freemsra.com.
Absolutely. Good luck with your studies.